Have you ever wondered what happens when the brain, the control center of our body, gets inflamed? Well, that's called encephalitis, a serious condition that can result in severe complications if not treated promptly. It is an inflammation of the brain, often caused by a viral infection. It's like a wildfire raging unchecked, causing damage and chaos in its wake. This may sound scary, but understanding the causes can help us prevent and treat it. So, what causes this inflammation in the brain? Well, there are several culprits behind encephalitis. The most common cause is viral infections. Herpes simplex virus is a notorious offender, but other viruses like Epstein-Barr, mumps, and even measles can lead to encephalitis. But it's not just viruses we need to be wary of. Bacterial infections, though less common, can also trigger encephalitis. Bacteria like Listeria or those causing Lyme disease are examples of this. Lastly, we can't forget about immune system disorders. Sometimes the body's own defense system can go haywire, attacking healthy brain cells and causing inflammation. This is often the case with autoimmune encephalitis. Each of these causes can lead to encephalitis in different ways, whether it's by direct infection, secondary effects from an infection elsewhere in the body, or an overactive immune response. Now let's delve into how these causes affect our bodies. How does a simple infection lead to such a serious condition? Well, let's dive right in. Encephalitis, as you may know, stems from an infection or an immune disorder that leads to inflammation in the brain. Imagine your brain as a city. Now, when an uninvited guest, say a virus, enters this city, it triggers the city's defense mechanism. This mechanism in our case is the immune system. The immune system's response to this invasion is inflammation, an attempt to eradicate the unwanted intruder. However, in the confined space of the brain city, this inflammation can disrupt the normal functioning of the city's infrastructure, meaning the brain's normal functions. This disruption can lead to the symptoms we associate with encephalitis, such as fever, headache, and even seizures. It's a complex process, showing us just how delicately balanced our bodies truly are. The pathogenesis of encephalitis gives us a glimpse of how it manifests in symptoms. So, what are the warning signs of encephalitis? Well, encephalitis often starts with flu-like symptoms, including fever and headache. However, as the condition progresses, more severe symptoms can develop. These may include confusion, drowsiness, and disorientation. Neurological symptoms such as seizures, partial or complete loss of sensation, muscle weakness, and problems with speech or hearing may also occur. In severe cases, symptoms can escalate to hallucinations, loss of consciousness, or even coma. Recognizing these symptoms early is crucial for prompt diagnosis and treatment. How do healthcare professionals diagnose encephalitis? That's the question we're exploring now. The diagnosis process for encephalitis begins with a detailed medical history and physical examination. Healthcare providers will ask about recent illnesses, vaccinations, and travel history. They'll also check for signs of infection, such as fever or stiff neck. Next, they may order specific tests to confirm the diagnosis. A lumbar puncture or spinal tap can help detect signs of inflammation in the cerebrospinal fluid. Brain imaging like an MRI or CT scan can reveal swelling or other abnormalities. Lab tests may also be performed to identify the cause of the encephalitis, be it viral, bacterial, or other. It's a comprehensive, methodical process to ensure an accurate diagnosis. Once diagnosed, what are the treatment options for encephalitis? Is it possible to treat encephalitis effectively? Absolutely. The treatment approach for encephalitis typically involves a combination of antiviral medications, immune therapies, and supportive care. Antiviral medications like acyclovir are often used to combat viruses that cause encephalitis, while immune therapies might be employed to manage certain forms of autoimmune encephalitis. Supportive care is vital too. It might include pain relief, fever reduction, hydration, and sometimes even respiratory support. Remember, early treatment is crucial, as it can significantly improve the prognosis. In some cases, rehabilitation may be necessary to regain lost skills or learn new ones. Knowledge is power. Understanding encephalitis can help us combat it more effectively. So there you have it, a comprehensive overview of encephalitis. We've unpacked its causes, pathogenesis, signs, diagnosis, and treatment strategies. Knowledge is power, especially when it comes to health. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to the Living Brain channel for more informative content like this.